am Dr. Ain, the Principal Doctor at Poliklinik Ar-Razi, Bandar Putra in Kuantan. We are a general practice and a primary care facility that provides comprehensive healthcare services to the community, including acute care, chronic disease management, minor procedure, preventive health, and a 24-hour urgent care services. On average, our clinic sees about 2,000 patients per month. The majority of our day-to-day consultation revolve around three main groups. The first one, chronic disease management, patient with hypertension, diabetic, dyslipidemia, asthma, and thyroid disorder. The second one, acute illness such as fever, respiratory infection, gastroenteritis, injuries, and skin condition. Preventive and family care too for vaccination, antenatal checkup, health screening, and children's health. On a typical day, around 50% of consultation involve managing non-communicable disease, particularly diabetes, hypertension, and hyperlipidemia, and around 50% generally involve communicable conditions such as URTI, dengue screening, gastroenteritis, and acute illness. So because we operate 24 hours, we often see patients who need urgent assessment outside regular clinic hours. The most common after-hours cases requiring immediate diagnosis include chest pain. We need to rule out cardiac causes with ECG and cardiac markers. For shortness of breath, assessing asthma attack, COPD, and other infections. High-grade fever with red flags such as dengue suspicion, dehydration, and gastrointestinal emergencies, more to food poisoning and acute appendicitis.
So before POCT, there's delays in receiving test result. They were a major challenge. So it slowed our diagnosis, reduced patient confidence, and patients required to return for reviews. It caused a hassle. The lab turnaround time was around 6 to 24 hours. Delays made it difficult to adjust treatment. Patients often skipped follow-ups and clinical cases needed faster clarification. Long turnaround time disrupted continually and clinical decision-making. So we wanted to differentiate ourselves among other clinics by improving the patient experience and build stronger diagnostic confidence. So this is what motivates us to adopt POCT. So we offer a variety of tests. We offer HbA1c, NT-proBNP, lipid profile, CRP, troponin, dengue tests, influenza AB, glucose, urine dipstick, and also pregnancy tests. So these were chosen because they immediately impact clinical decisions. The nearest central lab is at least 20 to 30 minutes away, so making POCT very essential. So the biggest change is the faster treatment adjustment. So HbA1c POCT improves compliance by giving instant feedback. NT-proBNP helps quickly differentiate cardiac from non-cardiac breathlessness. So example, a diabetic patient improves from a HbA1c of 10% to 7% over 3 visits with instant monitoring. The patient journey now includes quick registration, immediate POCT sampling, fast result, and instant treatment decisions. Diabetes patient itself benefits from fingerprint HbA1c test. Also, patient with having night chest pains cases benefits from on-the-spot NT-proBNP and troponin. So this itself improves referral decisions. The POCT itself improves speed and accuracy. We ensure reliability to QC, periodic cross-checks, and using clinical validated tests. So the reduced turnaround time allows higher patient volume, fewer follow-ups, and more confidence in clinical performance. We justified costs through improved patient retention, better workflow, and also reduced follow-up burden. So stronger clinical reputation can be built. The value extends beyond the clinical utility. We provide structured onboarding, also hands-on training, monthly QC, and yearly competency refreshers. So POCT is easier to train compared to full lab setups, improving manpower allocation. So the main challenge is explaining the added costs. I emphasize immediately where results, better accuracy, faster decisions, and avoid extra visits. So upon hearing that, acceptance rate is very high, around 80 to 90%. The main feedback I had were patients appreciate speed, convenience, and finger prick sampling. They feel the clinic is modern and very thorough in the assessment. Automating the data flow is the logical next step because there's faster and more reliable decisions, reduce the follow-up and the admin load. Also, there's better audit and quality control. The primary care will move toward a hybrid clinic. So POCT for rapid frontline tests, lab for complex tests, and also QC. So these three collaborations will be increasingly important.